Hello everyone, welcome back to Vessel Mnemonics, and today we'll be looking at the veins of the head and neck. Now, we'll start by saying that the artery moves blood away from the heart, thus the origin is closer to the heart, while the veins move blood towards the heart, thus the origin is far from the heart. The artery supplies while the vein drain. Now, the major veins draining the head and neck are the subclavian vein, internal jugular vein, external jugular vein, and anterior jugular vein. So the subclavian vein is part of the major vein draining the head. Now the cause of this subclavian vein, it is the continuation of the axillary vein and extends from the outer border of the first rib to the medial border of the scalenus anterior, which joins with the internal jugular vein to form the cephalic vein. So for us to remember the tributaries of the subclavian vein, we can use this mnemonic: cephalic date, cephalic for cephalic vein, D for dorsoscapular vein, A for anterior jugular vein, T for thoracic duct on the left, and right lymphatic duct on the right. E for external jugular vein. So the thoracic duct on the left is part of the tributaries of subclavian vein, and the right lymphatic duct on the right is part of the tributaries of the subclavian vein on the right. Now, the relations of this subclavian vein: in front, it is related to the clavicle and the subclavius muscles. In behind, it is related to the subclavian artery with intervening scalenus anterior muscles and the phrenic nerve. So below, it is related to the first rib and the corpora of the pleura. So from here you can see the relations: below, corpora of pleura and first rib; behind, it is related to the clavicle; in front, it is related to it's also related to the subclavian arteries and phrenic nerve. Behind, in front, is related to the clavicle and subclavius muscles. Now, the superficial veins of the head and of the neck, which is part of the subclavian vein. So the subclavian vein supplies the superficial part of the head and neck. Now, there are two superficial veins of the head and neck, and they are the external jugular vein and the anterior jugular vein. If you remember from our cephalic date, which is cephalic vein, to the scapular vein, anterior jugular vein, thoracic vein, and external jugular vein, forms the tributaries of subclavian vein. And these two of these tributaries of subclavian vein, which are the external jugular vein and the anterior jugular vein, supplies the superficial part of the head and neck. So the external jugular veins drain only a portion of extracranial tissues such as the skin, the muscles, and the blood vessels in the head and neck. So they drains the extracranial tissue, that's the external jugular vein. It begins just below the angle of the mandible by the union of the posterior division of the retromandibular vein and the posterior auricular vein. It runs almost vertically downward across the sternoclaviculomastoid muscles under the cover of the plastema to pierce the deep fissure in the anterior inferior angle of the posterior triangle, about 2.5 cm above the clavicle, along the posterior border of the sternoclaviculomastoid muscles, and enter the supraclavicular space. After passing through it, terminates in the subclavian. So why I highlighted this supraclavicular phase is for you to differentiate it from the anterior jugular vein. The external jugular vein actually passes through the supraclavicular phase, which is at the posterior border of the sternoclaviculomastoid muscles, to enter the to terminate in the subclavian vein. But the anterior jugular vein passes through this suprasternal space. We have two spaces covered by the deep fissure, which we discussed in the anterior triangle of the neck. The first space is the supraclavicular space, and the second space is the suprasternal space. The supraclavicular space is pierced by the external jugular vein, while the suprasternal space is pierced by the anterior jugular vein, and both of them supplies so both of them drains the extraclavicular part of the head. Although the anterior jugular vein drains around the submental area. So the tributaries of this external jugular vein can be remembered with past, posterior external jugular vein, anterior jugular vein, supraclavicular jugular vein, and um, transverse cervical jugular vein. So in the suprasternal space, the anterior jugular vein is united across the midline to its fellow of the other side by a transverse venous channel called jugular venous arc. So I told you that the suprasternal space is what contains the anterior jugular vein, and there's a connection between the anterior jugular vein of one side to the anterior jugular vein of the other side with an arch called jugular venous arc. So I'll be moving to the textbook for us to see it. So here is the connection between the um, anterior jugular vein with the other other part. Look at this is a jugular venous arc. It connects the anterior jugular vein with with the other side vein. Now from here you can see all these the tributaries of the external jugular vein. We initially said that the external jugular vein is the union of the posterior auricular vein with the retromandibular vein, the posterior deviation of the retromandibular vein. Then it moves downwards across the sternoclavicular mastoid, and about 2.5 cm above the clavicle, it pierces the deep fascials to unite with the subclavian vein. So, and we said it has parts which we use the pars to remember. It has posterior it has four branches which we can use pars to remember, and one of the branch is the posterior external jugular vein, the anterior jugular vein, the suprascapular vein, and the transverse cervical vein. Um, we also have some of the tributaries, which is the posterior. Uh, we also have some tributaries such as the oblique jugular vein, which is also. I told you that the supraclavicular space is where you see the external jugular vein, while the suprasternal space is where you see the anterior jugular vein. And we have what we call the jugular venous arc that connects the anterior jugular vein of one side to the anterior jugular vein on the other side. Moving on to the internal jugular vein as a second vein that drains the head. If you can remember very well, we say the major blood vessels that drain the head are the subclavian vein, internal jugular vein, external jugular vein, and anterior jugular vein. These are the major blood vessels that drains the head, and we're looking at the internal jugular vein. So, internal jugular vein is usually the largest vein in the neck. It begins at the stigma sinus at the base of the skull, below the jugular foramen, and descend vertically to end at the sternal end at the clavicle by joining the subclavian vein to form the brachiocephalic vein. So it begins at the base of the skull and it ends at behind the sternal and it ends behind the sternal end of the clavicle by joining with the um, subclavian vein. So the sternal end is the part of the clavicle that forms the joint with the mandible. So that's where the the internal jugular vein joins with the subclavian vein to form the brachiocephalic vein. So we can remember the mnemonics for the tributaries of internal jugular veins. That's the branches they have and what they drains with. Medical students let confident people in. So medical mean medial thyroid vein, superior thyroid vein, lingual vein, common facial vein, pharyngeal vein, inf- inferior petrosal vein. So the relations this um of this internal jugular vein can be the superior relations, the deep relations, and the middle relations. So the superior relations can be remembered with that it is crossed by two muscles, two nerves, two artery, and because it is a vein, it is crossed by two veins. So rules of two except vein. The two muscles are the posterior belly of the digastric muscles in the upper part and the inferior belly of the omohyoid muscles in the lower part. And if you have listened or watched the video on the anterior triangle, we say that the anterior triangle is basically formed by these two muscles, the digastric muscles and the omohyoid muscle. But this triangle, um internal jugular vein is crossed by the posterior belly of the digastric muscle and the inferior belly of the omohyoid muscle in the lower part. It is crossed by two arteries, which are the occipital artery and the posterior auricular artery. It is crossed by two nerves, which are the spinal accessory nerves and the inferior root of the anal nerve. Then it is crossed by one vein, which is the anterior jugular vein. And we are saying that the reason why it is crossed by a vein, the way to remember how many veins that crosses it is by knowing that since it is a vein, it is crossed by one, but others it is being crossed by two. So for artery, two artery, occipital artery, posterior auricular artery, for muscle, two muscles, posterior belly of digastric muscle and inferior belly of omohyoid muscle. For nerves, two nerves, spinal accessory nerves and inferior root of anal cervicalis. So the deep relations can be noted with the pictures below. The deep relations from above to below, we see the pictures here. The rectus carpalis lateralis, the transverse process of the ala, the lavatus scapulae, the sclenus medius, the cervical plexus, the scalenus anterior, the phrenic nerve, the thyrocervical trunk, the vertebral artery first part, and the subclavian artery first part. So the vertebral artery and subclavian artery all are deep relations of the internal jugular vein. Now the medial relations of the internal jugular vein is the internal carotid artery and and 9th, 10th, 12th, and 9th, 10th, 11th, 12th cranial nerve in the upper part. That's upper part is entire carotid artery and 9th to 12th cranial nerve. The lower part is common carotid artery and the vagus nerve. And we're looking at this vagus nerve. Vagus nerve is the 10th nerve, and so the vagus nerve still continues as the lower relations because the vagus nerve is actually regarded as a wandering nerve. So it's you expect it to cross the internal jugular vein at the upper and the lower parts. So from here we can see that the internal petrosal vein is the first tributaries of the jugular vein because the internal petrosal vein is look, located at the starting point, which is the sigmoid sinus at the base of the brain. Remember our mnemonics for tributaries of internal jugular veins, which are medical students let confident come in: middle thyroid vein, superior thyroid vein, lingual vein, common facial vein,